We are going to start, though, with the latest on the COVID-19 pandemic. Here in South Korea, the nation's Ministry of Food and Drug Safety is scheduled to announce its decision on whether to authorize Pfizer and Merck's oral COVID-19 pills for emergency use in this country.
For more on this and other COVID-19 updates is our reporter Han Seong-woo in the studio with us. Good morning, Seong-woo.
Good morning. Thank you for having me.
So, Seong-woo, like we just said, we're expecting the South Korean government to give the green light to Merck and Pfizer's oral treatments today. Tell us more on that.
That's right, Mokyeon. That announcement is scheduled to be made this afternoon at around 1 o'clock. If everything goes well, the Ministry of Food and Drug Safety gives the okay. If they give the okay, Pfizer's Paxlovid and Merck's Molnupiravir may be used by patients here in the country as early as late January. The government has currently procured or is in the final stages of procuring at least 542,000 courses of the treatments, 300,000 from Pfizer and 242,000 from Merck. Once given the green light to be distributed across the country, they'll be prescribed to patients recovering at home and those with mild to moderate symptoms. The United States Food and Drug Administration earlier authorized both pills for emergency use last week.
And Seong-woo, can you give us the latest on the tally of new infections we might be expecting in South Korea today?
Of course, we're expected to see at around 4,000 cases reported today once the official daily tally comes out later in the morning. Health authorities marked up to 3,774 new cases up to 9 p.m. Sunday, more than 1,000 less compared to the same time both the day before and a week earlier. Officials have been saying recently that the resurgence seems to be on a downward trend now, thanks to more and more people receiving booster shots and the strict antivirus curbs currently in place across the country.
Now, Seong-woo, tell us more about how much Omicron has spread around the country.
Well, I think it's safe to say that the Omicron variant is everywhere. What I mean by that is that Omicron has been detected in every province in Korea except Chungcheongnam-do province. As of Sunday, the total number of cases stands at 376. Not as high as it is in Western countries, of course, but concerning nonetheless, considering 215 of those cases are local transmissions, many of them coming from unknown infection routes. Authorities say it's inevitable that Omicron will become the dominant strain in the country, likely by February next year.
Okay, well, that's quite surprising. We were told it was much more transmissible. I would have thought it might have been the dominant strain much faster than that, but we're going to speak to an expert on that in just a moment. But this variant, this Omicron, has become a real obstacle for people who want to try and travel abroad, correct?
That is correct. According to flight tracker FlightAware, a total of 7,202 flights were canceled worldwide in the 3-day period from Christmas Eve to the 26th of December. A huge chunk, more than 2,000 of those canceled flights were trips either departing from or arriving in the United States. Aside from international travel restrictions, American media outlets are also reporting that the airline industry has also been heavily hit by infections among pilots, flight attendants, and other industry insiders, rendering them unable to work.
Now, Seong-woo, speaking of the U.S., how is the Omicron situation over there?
Very bad, I must say. For the first time in almost a year, the U.S. is seeing a daily average of more than 200,000 COVID-19 infections, and the Omicron variants accounting for the vast majority of them. Data compiled by the New York Times shows the daily average of new COVID-19 cases in the country over 7 days hit 201,330. That's a 69% increase from 2 weeks prior. A particularly worrying trend is the rise in infections among minors. According to the American Academy of Pediatrics, COVID-19 infections among those under 18 as of December 16th had risen by 170,000 from a week earlier.
All right, Seong-woo, let's hope the situation gets better. Thank you so much for your report today. Hope we talk to you again soon.
Thank you.